Hi, my name is Mary. I'm the Diabetes Clinical Coordinator here at UPHP. Today we are going to talk about labs that those with diabetes will frequently need to have. The first one is called a hemoglobin A1c. And what you should know, well, first of all, what's going through my head is I love labs. Labs are interesting to me. So I get a little excited about it. What you start with is sugar. Sugar enters the bloodstream like we know from previous videos, and it attaches to something called hemoglobin. Hemoglobin is part of your red blood cells, and so when you eat a lot of sugar, a lot of sugar enters your bloodstream, it attaches to the hemoglobin, and the more blood sugar you have, the more sugar is attached to the hemoglobin, so those cells get laden with sugar. The hemoglobin itself only in your bloodstream for 3 months. So when you get your hemoglobin A1c tested, it's for the previous 3 months. It's checking how much sugar is on that hemoglobin. What is important, so hemoglobin lasts 3 months. That's why you can't get your hemoglobin A1c tested more than 3 months. It won't show anything different. But you need to have your hemoglobin A1c tested approximately every 3 to 6 months, and some providers even go as far as 1 year. But what you need to do is just follow your provider's recommendations and make sure you get them when they want you to have them done. A normal A1c is less than 5.7%. Pre-diabetes is 5.7 to 6.4, and diabetes is more than 6.5. So those living with diabetes should aim to have a hemoglobin A1c of less than 7. And now I mentioned that the pre-diabetes value is 5.7 to 6.4. This is why it's important to have the test done as your doctor or your provider recommends, because if you have that pre-diabetes value, you can reverse it with lifestyle and exercise. And if you have more questions about that and want me to go in depth further, please let me know in the chat below or the comments below. The next important lab for anybody living with diabetes is those kidney labs. They're very important. They're done on your blood and your urine. Kidneys filter toxins out of your blood. They also regulate the fluid balance in your blood. 65% of kidney failure in the United States is caused by diabetes or hypertension. So with all of that, it's very important to have the blood work or your blood and urine checked as your doctor prescribes. It's usually every 3 to 6 months or a year. Every year is the same as the hemoglobin A1c. Now your kidneys, they're located just underneath your ribs on each side of your spine. They're surprisingly bigger than I expected when I first started learning about that. They're about 4 to 5 inches long. So they filter blood. Like I said, they get rid of all those toxins and things that we don't need, and excess fluid, and it all goes into your bladder. So that's where, if your kidneys aren't working, you're peeing more often. Chronic kidney disease can happen and you will have no clue. It could be happening in your own body. It's what they call a silent issue. So the first signs of kidney disease, they would be muscle cramping. Your urine might be dark, or it might be bloody. It might be foamy. Your skin might start to itch or get really dry unreasonably. If you typically have dry skin, having dry skin does not mean that you have kidney failure. It just, all of the things together could mean kidney failure or kidney issues. Other issues you can have is your eyes might start to get unexplainably puffy, or your ankles and your feet get puffy as well. That's because your kidneys aren't getting rid of that excess fluid in your bloodstream, so it has to go somewhere. So it just, for some reason or another, collects in your lower legs or your eyes. So then what can you do to help keep your kidneys healthy? Big thing, avoid or quit smoking. Cut back on salt. That gives your kidneys less to filter out of your blood. Drink a lot of water. That helps thin out your blood and lessen the load on your kidneys. Increase the amount of intentional exercise that you get. Don't eat exercise, it wouldn't taste good. Maintain a healthy weight. Limit the amount of NSAIDs or anti-inflammatories that you take. This would be like ibuprofen or Aleve. And maintain a healthy blood pressure. And also, of course, maintain a healthy blood sugar. So that's a quick overview of those two important areas of testing. If you have any questions, of course, please let me know. Again, my number is 906-227-5691, or you can contact me at mwalters@uphp.com. Thank you.